Okay, welcome to MIT, and thank you for joining us here this morning at the Sloan School for Designing for Health, Leveraging Analytics for a Proactive Health System. Well, I'm Maria Zuber. I'm the Vice President for Research here at MIT, and I'm happy to kick this event off and pleased to see this good turnout. I'd like to thank our alumni and friends for being here today in support of MIT, and our current students for representing a very special part of our community. I'd like to thank our speakers and panelists who've traveled from around the country to join us, and I also want to provide a very special thank you to all of the organizers. The current healthcare landscape is challenging, and it's changing at a rapid pace in this digital age. It ought to be easier to find a workable, efficient system for caring for patients than it is to discover cures for perplexing diseases, but it often doesn't seem like that's the case. We need change agents, and I'm directing that comment squarely, though not exclusively, at the students. Here at MIT, we apply our technical, analytical, and systems lenses to tackle some of these tough challenges. Solving difficult problems is at the heart of what inspires, motivates, and drives our faculty and students. Making a positive impact and creating a better world through healthcare can take shape in many forms, from developing a smartphone app to address substance abuse, to designing 3D printed diagnostic devices to provide low-cost solutions for labs to detect a range of infectious diseases, to experimenting with the implementation of programs to create a reverse copay to incentivize individuals to schedule and show up for their appointments. MIT Sloan's faculty are leaders in creating practical solutions that will positively impact the future of health, and they're eager to share their vision of the future of healthcare with you throughout the day. Our forward-thinking approach to improve the future of humankind is critical to MIT's mission to advance knowledge and education in science, technology, and other areas of scholarship that will best serve the nation and the world in the 21st century. I hope that all of you in attendance will think about what role you can play in collaboration with us and many others to transform healthcare systems and to advance health management and delivery. And now I'd like to move on to the program and introduce our next speaker, Mr. Ron Williams. Mr. Williams has served as chair of the HSI Advisory Board since 2016, and he's a member of the MIT Corporation. He is the chairman and CEO of RW2 Enterprises, LLC, and is the former chairman and CEO of health insurance giant Aetna Incorporated. Mr. Williams now focuses his energy on private equity, values-based leadership, and transformational change, and healthcare value creation. He was elected to the American Academy of Arts and Sciences and is a trustee of the Committee for Economic Development. He served on President Obama's President's Management Advisory Board from 2011 to 2017. He's a graduate of Roosevelt University and was a graduate of the MIT Sloan Fellows Program in 1984. Please join me in welcoming Ron Williams.
Well, thank you, Maria. I see you got the introduction my father sent over, so thank you very much. I want to make a few introductory comments. First, I want to thank my fellow advisory board members, and maybe I could ask them to stand, who spent a day yesterday going through the program and making certain the strategies here. We do have a few here. Many of them weren't able to make it. I want to thank you for taking time out of your busy schedules to come and participate, because I'll tell you, as a student of healthcare, I continue to learn something new every day, and I actually learned something new today in a conversation with a colleague here. This is a particularly exciting time in healthcare. I can tell you that the change that we're seeing is really dramatic, and there's an expression about change which I find very apropos to where we are now, and that is that there are decades when weeks of change happen. And then you have weeks where decades of change happen. And we're in that period. And I can tell you, if someone had told me that Aetna, the company I ran, would have been acquired by CVS for $70 billion, I would have suggested that they were sampling an agricultural product. When you think about the change going on, whether it is the acquisition by United Health of physician practices, where United Health has over 50,000 physicians operating within their company in a variety of models. When you think about the hospital delivery systems, Dignity Health doing what I'll call an acquisition merger, one of the largest Catholic healthcare systems, creating a system even larger than Ascension. When you look at what's going on in precision medicine and in research in general, I serve on the board of Johnson & Johnson, so I see the research that's going on in pharmacy, in medical devices, and in consumer healthcare. So this is a really exciting time, and I think one of the most important things is the recognition that healthcare and health does not happen in the physician's office or in the hospital, that it happens, broadly speaking, in all of the interactions that we have as patients and as consumers and as members of our community and as members of society. And I think one of the opportunities for the intellectual capital that this group brings, that the faculty brings, and that the students bring, is an opportunity to look at how we take something that is not a system. No one would design a healthcare system that works the way the US healthcare system works. And known for systems thinking and end-to-end perspective, I think that we're uniquely qualified here to be an important part of the solution. Now, change is not going to be easy. When you improve quality or you change a business model or you reduce costs, someone's cost goes down, somebody else's revenue goes down. And so we have to look at it holistically and make certain that all parts of the system are taking the trip and actively participating in what we're doing. So I really want to get on with the program. I want to thank you all for coming, and I'd like to introduce Jay Levine, who's going to take you through the program for the day.
Thank you, Ron. Good introduction, setting the tone for today. I am Jay Levine. I will serve as the moderator of the conference today. I am a happily retired management consultant. I spent my career advising medical schools, teaching hospitals, universities, faculty practice plans, and other components of academic medical centers and universities for over 30 years. I sit on the board, as Ron pointed out, of the Health Systems Innovation. I've been on the board since the group's inception, and I also serve on the board of directors of a community hospital in New York State. You know, planning a conference such as this generally starts 6 or 8 or 9 months, 10 months in advance of the conference. And you hope when you put together the agenda that the conference is going to be relevant when the date of the conference eventually rolls around. Like, for example, if we were planning a conference to help states and cities deal with blizzards, you would kind of hope for a good snowstorm about a month beforehand, because it creates an impetus for the conference. It makes the conference seem more relevant. Well, we had our symbolic snowstorm on November 14th, when the Secretary of Health and Human Services, Alex Azar, gave a speech on that day. And I want to highlight some elements of that speech. He spoke, the speech was really devoted to not only the critical issues related to the social determinants of health, but also the expanded role that he envisions Medicare and Medicaid will play in addressing the social determinants of health. So I'm going to quote 2 or 3 sentences from his speech. He said, "Social determinants of health is an abstract term, but for millions of Americans, it's very tangible, a frightening challenge. How can someone manage diabetes if they're constantly worried about how they're going to afford their meals each week? How can a mother with an asthmatic son really improve his health if it's their living environment that's driving the condition? This can feel like a frustrating, almost fruitless position for a healthcare provider who understands what is driving the health condition that they're trying to treat, who wants to help but can't simply write a prescription for healthy meals, a new home, or clean air. That's the end of the quote. Today's presentations and discussions will address topics leveraging analytics for a proactive health delivery system. I believe that Secretary Azar would find today's agenda interesting and relevant. We have an engaging full day of programs, presentations, and discussions that will conclude at the end of the day with a networking opportunity out in the foyer. You will hear from our distinguished speakers, including leadership from MIT and the Initiative for Health Systems Innovation, faculty members from MIT, from Harvard, from the University of North Carolina, from the University of California in San Francisco. You'll hear from MIT alumni. You'll hear from leaders of the public sector in California, New York, and Rhode Island, as well as industry leaders. All of these individuals are focused on improving health systems that impact us all. I'd like to now introduce our first formal presentation by Joe Doyle. Joe is a friend of mine and a professor of applied economics at MIT Sloan School of Management. He's the faculty director of the MIT Sloan Initiative for Health Systems Innovation and co-chair of the health sector of the Jameel Poverty Action Lab. His research investigates the source of healthcare value and waste to inform policies aimed at improving the quality and cost effectiveness of the U.S. healthcare system. This includes collaboration with large healthcare providers, payers, community organizations, and he conducts randomized controlled trials of change in the ways of healthcare delivered with an emphasis on addressing social determinants of health. I always find Joe's presentations to be fascinating and insightful, and I'm confident that today's presentation will not disappoint. So Joe, would you please join us?
Sure.